Hello, my name is Dr. Dewan S. Raja. Today I will discuss about achondroplasia. Achondroplasia, the most common skeletal dysplasia and a major cause of dwarfism, is an autosomal dominant disorder characterized by reduced endochondral cartilage growth. So the intracartilaginous ossification is disturbed here. The disease is caused by gain of function mutations in fibroblast growth factor receptor 3, that is FGFR3. FGFR3 typically inhibits endochondral growth. In achondroplasia, the receptor is constitutively active, causing a pathological suppression of bone growth. Approximately 90% of cases stem from new mutation, almost all of which occurs in paternal allele. So it is usually found to the children who born from the old fathers. Key characteristics of achondroplasia: short stature. Individuals with achondroplasia typically have short arms and legs, resulting in an adult height significantly below average. Disproportionate limb. The trunk of the body is usually of average size, but the limbs are shortened. The trunk may show the features of scoliosis in some individual, that is bending of the trunk, the vertebral column. That may be an association. Okay. Enlarged head. Individuals with achondroplasia often have a relatively large head with a prominent forehead. There will be frontal bossing and conspicuous depression of the root of the nose. Limited range of motion. Some individuals may experience limitations in joint movement, especially in the elbows. Hydrocephalus. There is an increased risk of developing hydrocephalus and increased intracranial pressure. The skeletal abnormalities are usually not associated with changes in longevity or intelligence. So an achondroplastic patient may have better education if they are supported. And from my own knowledge, there is a surgeon, pediatric surgeon, who was a patient of achondroplasia in the United States. Okay, so these are the features. We're looking some. There will be macrocephaly, comparatively frontal bossing, mid-face depression at the root of the nose, rhizomelia, shortened limbs. Limbs are short, and especially in the proximity, short. Okay, tri-dart hand. That means almost all the fingers are short and equal in length, especially this is the orientation at the first intermetaphalangeal joint. Genu bheru. So this bone is directed medially. Okay, Genu bheru, bowing of the tibia. Okay, we got that. Here we see a child, and this is the X-ray picture. The tubular portion of the diaphysis as a whole, diaphysis is shortened. There will be flaring up of the metaphysis here. Okay. Diagnosis: achondroplasia is usually diagnosed shortly after birth based on physical characteristic, what we have discussed. Genetic testing can confirm the presence of FGFR3 gene mutation. So, what is the treatment? There is no cure for achondroplasia, but various interventions may address specific challenges. Monitoring for and addressing potential complications such as spinal stenosis that may happen, ER infection, and joint tissues. And this is crucial. In some cases, growth hormone therapy may be considered to promote increased height in children with certain type of dwarfism, but that may not be applicable or effective in achondroplasia. Surgery may be performed to relieve pressure on spinal cord in case of spinal stenosis. Physical therapy can help improve mobility, muscle strength, and joint flexibility. Some individuals with dwarfism may benefit from assistive devices like that of some orthopedic devices. Psychological support to cope with social and emotional aspect of living with a condition that affects stature. So there will be psychological support for the patient. Educational support is important for individuals with dwarfism to ensure that their unique needs are met in academic setting. So their sitting arrangement, their support arrangement should be increased. Okay, and that's all about dwarfism or short stature due to achondroplasia. Okay, so if you have any question, please feel free to ask me. Please share the information with your friend. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.